International Journal of Health Policy and Management. Quality and speed are our culture and the keys to our success. Welcome to the audio summary section of the International Journal of Health Policy and Management.
This respirator is better known as the iron lung. It was state-of-the-art in life support technology in the first half of the 20th century. It saved many lives during polio epidemics. It was also extremely expensive, but because there was so much room for improvement, it probably provided good value for money. Nowadays, healthcare has much improved, and therefore the room for improvement is much smaller. Therefore, the healthcare technologies that are currently being used and developed often do not provide value for money. Ideally, we would like to know in a very early stage which of those technologies are promising, like this iron lung, and which are not so promising. Therefore, health economic modeling is used in increasingly early stages of development of the technology. In such an early stage, we can look at the room for improvement of a technology, what are possible scenarios, and how effective should the innovation be in order to provide value for money. In the previous years, we have performed 32 of those assessments of 30 unique cases. In this study, we have looked at those 32 assessments retrospectively to see what we can learn from them and really what is the value of those assessments. From the 32 assessments, we found that none of them resulted in a clear no-go decision or recommendation because all had potential to provide value for money. However, the assessments did provide insight in how to continue with development of the technology, specifically regarding development and positioning of the technology.
One of the assessments we performed was about an e-health innovation called See My Life. The platform aims at improving patients' adherence to medication and physicians' adherence to guidelines. During our assessment, this platform was still under development. Using an early economic model, we assessed the potential value of the platform on health gain and cost savings. Our headroom analysis showed that there is considerable room for improving patient adherence to medication and physicians' adherence to guidelines. From a value perspective, the platform could best aim at improving patient adherence to medication first.
Also, the assessments were helpful in informing further research because we found which information was most valuable. In conclusion, we found that early health economic modeling is informative in steering the development and research of innovative technologies in a very early stage. If we go back to this iron lung, we probably would have found from the assessment that it was a good idea to continue developing it. But we could have also given recommendations for how to position the iron lung or how to develop it in order to provide most value for money.